Okay, 7 o'clock. We'll call this meeting to order. I don't have a, I don't have a hammer here. I gotta have a hammer. There we go. We'll start with the Pledge of Allegiance. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, reading of the call. There, we gotta turn this on.
Dear Supervisor, please be advised that the Trempealeau County Board of Supervisors will meet at 7 p.m. on January 20th, 2025 in the county boardroom. All county board members' claims are due to the county clerk's office by noon on January 6th, 2025, so they can be prepared for audit committee approval. Sincerely, Mary Martin, County Clerk.
Do the roll call.
Bridget Turner,
Here.
Stacy Klein,
Here.
Richard Seisha,
Yes.
Lori Severson,
Here.
Andy Todd,
Here.
Richard Anderson,
Here.
Kevin Adams,
Here.
Dick Miller,
Here.
Kevin Whalen.
Did you say me?
No.
Oh,
Kevin. John Austin,
Here.
Dawn Waldera,
here.
Robert Becker,
Here.
Renee Lyon.
Here.
Kellen Nelson.
Here.
David Larson,
Here.
Jeannie Nutter,
Here.
Ron Johnson.
Here.
All right, 16, 1.
Okay. Got it. Certify open meeting laws requirements have been met with proper posting and notification. We have a 14-item agenda.
Move to approve.
Motion by Supervisor John, second by Supervisor Seisha. All those in favor signify by saying aye.
Aye.
Aye. Aye. Aye.
Opposed, same sign. That's carried. Approval of the December 24th session minutes. Somebody will make a motion by Dawn Aldera.
No,
Oh,
Becker.
Renee Lyon. And seconded by Addie Becker. All those in favor signify by saying aye.
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 Aye. Aye. Aye.
Opposed, same sign. Hearing none, that's carried. Appearances. Administrator.
All right, thank you. Well, I'd like to, I'm glad you all made it, and for those of you online, you're the smart ones that are attending at home or in the warmth of your home. I want to share first an email that I received from Lori Halama with each of you. She says, I wanted to express my heartfelt appreciation for the retirement party, the gifts and everything everyone helped to plan to celebrate my retirement. It was wonderful. Please let all employees and county board members who brought food for, helped plan, and attended the party, I'm very thankful for their participation. I miss all the people I worked with, but I'm enjoying my retirement, especially on these cold, cold days. I love not having to go outside. Take care, Lori. I just want to thank each of you as well for supporting that event and just making it just a wonderful time for everyone. And I was so sad that I couldn't be there because of being sick, but everyone that stepped up is just very appreciative. Renee, for your extra help in coordinating that. So just to everyone, thank you and for supporting that. They really appreciated their jackets as well. So wanted to let you know that first. Then I wanted to remind you that you got an email and you also got a paper copy of my 360 review. If you could complete that by January 27th, I'd like that all wrapped up and done on that date. So if you haven't done that yet, please do so. And then just to let you know that today's staff, it is Martin Luther King Jr. Day, and so we conduct our employee training on this day. So I want to thank the Whitehall School District for allowing us to have that over at the auditorium so that we could have all staff there. And we had a wonderful speaker that talked to us about intentional culture and how we will work together over this next year and just made us really come together and think about some things and working together. So appreciate that again from the board and the ability for us to have a training service like that, a harassment training as well for all staff. So that's all.
Okay, thank you. Department of Health and Human Services, Jay?
Right, thank you. I don't have a long update here, but I did want to just share a few pieces with you. We, as a new combined department, it was.
Did he turn his mic on?
Oh,
It is on. Can you hear me now?
can't hear him?
Can't hear Jay.
Can't hear me?
Okay.
It shows it's on.
How about now?
Oh, that's perfect.
Perfect.
Dawn was gracious enough to share her mic. All right, I don't have much of an update. I did want to share that we did have our first combined all-staff meeting on November 21st, so it was a little bit before the official date, but it went really well. We did a lot of introductions, and I think folks really enjoyed getting to know each other. So we also have met with, for the health department side of things, we've met with the state DHS in our 140 review. And we are going to be following up with them in a meeting in the next week or two with the results of that, and then what that will mean for our department. For the time being, we are remaining a level 2 health department, but I think we'll just have a few things to follow up on, action items and things like that. So, we're very encouraged by that. We are hoping to schedule interviews for the new health officer in the next couple of weeks here. We've got 4 applicants in the screening process. And so I'm hopeful that we'll find somebody fairly quickly and get that person in place. So, and in the meantime, we've still got Chris Hovel continuing as our public health manager, and then Nanishka Ruiz continuing as our interim health officer. So they're tag teaming, and Tricia and I are supporting them as well as we can and learning as we go. So. And then the other piece that just kind of more housekeeping things, we're just looking at beginning to integrate some of our forms and processes, and just for efficiency and balancing workloads, letterhead, purchasing, things like that. I mean, we're starting small because there's a lot to kind of integrate over time, but we're kind of going with the low-hanging fruit first, and then we're approaching it strategically, I guess I'd say. So, yes, Kevin.
Do you know when our next, you and/or our Madam Administrator know when the next joint committee meeting is, the official joint meeting for the Health and Human Services Board are? I know
Yes.
there's already been some potential members named or nominated, but do you know when the next official meeting will be?
Yes, and I believe our county administrator has that date as well. It's going to be the second Monday of every month at 5:30.
Just like the old health board was. Okay.
Yep.
So that's not changed, at least on the health side, that's not changed, basically.
Well, that one was the first Monday of every month at 5:30. It'll be the second Monday of every
So
month.
there's not much.
It's kind of a combination of,
Yeah, so it's not much of a change.
right, not too much. A little bit later, though. Yes, 5:30.
5:30. Instead of the first, it'll be the second.
Second Monday at 5:30,
It's
yes.
not only a week difference, all right.
Any other questions, or? All right. Thank you.
Thank you, Jay.
Yep.
Okay, well, that's, I think, 3rd month in a row we've been looking for a Chippewa Valley Health Cooperative, and Carl's here tonight, so.
All right.
There, Mr. Green.
I appreciate your patience with me and persistence with me. So I'm going to put a program up on the screen, and I hope that this works. It's starting to work. There we go. And what I'd like to do is just talk very briefly about some of the work that we've done with the Chippewa Valley Health Cooperative, and in particular answer questions. The benefit of, I guess, speaking to you today rather than back in December is there's been a few things that have happened, very positive, that I am very happy to report, that I'll be able to report today that I wouldn't have been able to report back in December. So as you guys probably remember, about this time last year, we started to hear word that there were not one but 2 of the health sisters health system hospitals were closing up in Eau Claire. That was the St. Joseph and the Sacred Heart. With that, that also included 19 Prevea clinics in and around the Eau Claire area. And for us at local government, I formerly worked as the La Crosse County Extension Educator, Community Development Educator, did a lot of work putting together a lot of data, a lot of economic development data. I was really blown away during COVID when La Crosse, which as I had always sort of been told was a recession-proof community, because we had a college, we had hospitals. That was the new economy that was supposed to be recession-proof. And once COVID hit and they started to say, we don't need elective surgeries anymore, and they started laying people off, that was very scary. And that really spoke to me with the importance that healthcare actually plays in the economies of our counties. And so I really thought that it was, while yes, is this really local government education? Well, we're trying to preserve a lot of jobs that are going to really preserve local governments and the solidification, because of all the jobs that represented, which was 1,400 jobs in the area. So we started helping the organization look at a structure. One structure that was proposed to them was a cooperative. Healthcare cooperatives are actually a unique sort of form of incorporation. A cooperative is incorporated by the members, and the members can really be anybody that is part of the group. And so with the healthcare cooperative, doctors, nurses, and patients can actually be the members. And that's the uniqueness, I believe, of a cooperative, is that it's owned by the people that are making the decisions, and they can make decisions that are a little bit more focused on the patient rather than the bottom line. And that, in specific with what we experienced up in the Eau Claire area, was part of the reason of the closings. Actually, the state of Wisconsin leads the country. We're the second most prolific in cooperatives, Minnesota being the first most prolific, and you recognize probably some of the cooperative names that you'll see up here from around this area. So a new healthcare cooperative was started. We opened it. I say we. We're helping them. We're not part of them in any manner. They opened it up for members to join, $25 for community members, $100 for physicians. And they are going to have an organizing meeting coming up this spring. They currently have a board of originators, the people that are making the decisions. That will then be handed off to a board of incorporators. The proposal now is about a $150 million hospital. I say about, it's now been shaved down to about $140 million. However, they are planning that in the Eau Claire, Chippewa Valley area. There's been a financial pro forma, so in order to move forward with any sort of lending to get for this work, we have to be able to illustrate through a third-party organization that this is viable and will function viably if the estimates are as planned. That data, Whipfly was the one that did the pro forma. They released their information in early December. That basically, yes, this is a viable organization and can perform with the estimates as promoted. And so we have community ownership with over 400 members so far. Actually, that number is up around 600 members now. We had a community meeting in December in Eau Claire in which we announced that the 501c3, which means they're a nonprofit, that designation was awarded. So they now are a viable 501c3, meaning they can receive philanthropic donations. And then we found out that we were going to be a player. Again, I say we, the Chippewa Valley Health Cooperative, was going to be a player in a bid for the actual existing St. Joseph's Hospital. And so an organization went through and removed whatever could be removed, and now the building is up for sale, and the cooperative is looking at that to purchase. Because they feel like that would at least give them an initial start, an initial ability to treat clients and provide health care, which basically got removed once the organizations left. And then while the main goal is to function a 140 million new hospital, this would at least give them some revenue and some treatment abilities until they get to that point. So that's actually a very exciting effort that is moving forward. We will find out in sort of mid-March whether an offer is going. So we're doing what's called due diligence. They're going through the actual building, making sure that there's not structural, environmental, any sort of physical damage that wouldn't allow them to operate. And then they will make a decision in March, with the idea that possibly in fall of 2025 they could, if everything goes right, get that up and running. Turns out there's a lot of steps involved in starting a hospital. That's really interesting, but yes, ma'am.
Might be that you're going to get to it, but I'm interested. How large of a hospital are we talking?
So it was a 40-bed, I believe, is what they would have, a 40-bed surgical center.
Thank you.
Yeah, it wasn't, it's not going to be a huge, and there are currently Mayo and the organization out of Marshfield Clinic, but Marshfield Clinic is struggling, Mayo is struggling to keep up with the capacity that was left when we lost those two hospitals. There's been an announcement by Aspirus that they were going to come in and they were going to do some work. It was really kind of news to us because all the municipal and county organizations that we had been working with didn't know about this. And they were kind of promoting an idea that was really more of, we'll keep them in the network, but we're going to try to treat as many people locally, but when we have surgeries and whatnot, they'll be taking those to Marshfield, or to, Wausau. So it wasn't really as big of a potential benefit as was being proposed. The benefits, I think, of what is being proposed with the cooperative, again, it's a locally owned organization, so it's owned by the doctors, the nurses, and the patients. Decisions aren't going to be made in Springfield or Rochester or somewhere external to the Eau Claire area. It restores access to very urgent health needs in the community. In particular, cancer care. There was at least 300 cancer patients that essentially were told they had to find cancer care elsewhere. So hopefully by at least fall of '25, that will be restarted. We hope to have a positive impact on pricing because this is a big issue with, as you have a limited amount of supply of health care and you have a lot of procedures, there's going to be a cost potential. So we hope that this has a positive pricing impact as well as a positive quality impact. We have, or this organization has the ability to control what the patient receives because they are the patient. And that's really, I believe, what will help make and set this separate. They also have a committed physician practice group, which is the Oakley Physicians Network. This is a different organization than the Oakley Surgical Group. I can explain the difference, but essentially they are two different organizations, and the benefit of having the Oakley Physicians Network, physicians need a hospital for which they can practice, and this provides that hospital for them for which they can practice, and they're committed to this as they are some of the investors. So what has Extension done? And I think I have one more slide. So we've connected the cooperative with a financial consultant. We vetted and trained the board members. We assisted in incorporating them into a 193 cooperative. We assisted with applying for the 501c3 charitable status. We've assisted with fundraising, reviewing fundraising agreements. We're just trying to help provide any sort of way that we can help so that this organization can get moving, and we acted as a liaison in this fashion, coming to county governments and municipal governments to just present what the organization is doing thus far. So here's my contact information. Again, please, I want to make sure that you guys are aware of what we're doing, and if you have questions of what we're doing, please give me a call, send me an email. We could come bring some of the board members if you guys want a more in-depth discussion on sort of their direction. I guess my final thing before I leave, again, the benefit I see of this organization is that it's a locally organized community organization that is going to be making decisions for everybody locally, and that's really the benefit of this cooperative that is unique from some of the other healthcare systems.
Mr. Chair. Is there anything within this plan to provide inpatient treatment for mental health patients?
So that's been
Question.
a big question, is the mental health. One idea that at this point, they haven't said they're going to say no to mental health. They have to figure out that balance of how much mental health that they have. So they are committed to working with patients of behavioral mental health. The thought was, could that building that was the hospital that now is going to be a hospital again for a few years until the new hospital is built, could that come into play to be a mental health? It doesn't serve as a hospital great because of its age, but it could work as a building that would provide some sort of services. So we're looking at those types of arrangements. We've got discussions, and we're ongoing with a private provider, but that needs a place to practice that. And so that is one of the concerns, and we've certainly heard that from both elected officials and the public.
I'm glad to hear that, because like I'm saying, because you're only going to, even if you get the old St. Joseph's Hospital, it can only be used as a temporary or Band-Aid. But it's like I'm saying, once you move into the new hospital, that'll building be open, so why lose that building again? Plus, we could still have our mental health, so you just read my mind on that one. If you guys reuse at least some of that building, because why would you buy it and you're going to be back in the same boat in empty buildings? You guys already own it, the cooperative owns it, why not keep it and use it for that? So you guys are already thinking great minds on that.
Good. They don't own it at this point. They will make that decision in March, but that's the
If and when,
thought.
yeah. Like I said, if and when they can get a hold of the building, again, after the medical section's moved out of there, why not, again, keep the building, use it for mental health, and even if we don't use the whole building, we can grow into it, so it's a good idea.
Chair, quick question for you. Is there going to be possibilities like at clinics, walk-in clinics? So those $40 pays instead of the have to deal with insurance like they have here in Holman?
Yeah,
For the people that don't have it?
I don't know if we're that far ahead with our planning. I mean, I know that there's, currently they're trying to figure out what is the best way to make money as a surgical hospital. Part of the hindrance that they had as St. Joseph's and the former hospitals was the age of the facilities. You put up a new hospital, and within 10 years, it starts to, codes are updated and things are aged, and eventually it becomes, where you have to put more into it. And so, that's really their first initiative, is to have this surgical hospital that's efficient, clean, able to do 21st century surgeries.
Any other questions? Hearing none, thank you, Carl.
Okay, thank you very much.
Thank you.
Okay, resolutions. Exec Finance Committee designating Trempealeau County Public Depositories. Want to read it?
I'll read it.
Okay.
Unless you'd rather I didn't. Whereas the Samuels Group has opened up an account at Summit Credit Union in West Bend, Wisconsin, to allow Trempealeau County to deposit money into the account for paying construction costs incurred for the remodeling of the old courthouse project. And whereas Summit Credit Union is currently not on the county's approved list of depositories. And whereas this updated designation and authorization is required to conform with Wisconsin Statutes 34. And now be it resolved by the Trempealeau County Board of Supervisors that effective upon the signing of this resolution, the following 36 institutions qualify as public depositories under Wisconsin Statute 34.01, and until further action as public depositories, and authorize the deposit and withdrawal of county money from these banks for all public money coming into the hands of the county treasurer in Trempealeau County, Wisconsin. And last month, Paul read all the banks. I can read them again if you'd like. We just added the Summit Credit Union in West Bend.
Okay.
Be it further resolved that withdrawal or disbursement from the above-named depositories shall be only by order check as provided by Wisconsin Statute 66.0607, that in accordance therewith, beginning January 6, 2025, that all order checks shall be signed by the following persons: Mary Martin, Trempealeau County Clerk, and Michelle Rose, Trempealeau County Treasurer, and shall be so honored. Be it further resolved that in lieu of their personal signatures, the following facsimile signatures, which have been adopted by them as shown, may be affixed on such order checks, and that the above-named depositories shall be fully warranted and protected in making payment on any order check bearing such facsimile, notwithstanding that the same may that the same may have been placed thereon without the authority of the designated person or persons. And we had signed it before, so that's why it's blank on this one. Be it further resolved that a certified copy of this resolution shall be delivered to the above-named depositories, and said depositories may rely on this resolution until changed by lawful resolution. Signed by David Larson, John Austin, Bridget Turner, Richard Seisha, Robert Becker, Exec Finance Committee.
Okay. Motion to approve?
I'll move to approve.
Second.
Motion by Supervisor Waldera, seconded by Supervisor Nelson. You want to just call the roll?
I sure can. Richard Seisha. Oh, I'm sorry.
Yes. Okay.
Okay. Richard Seisha,
Yes.
Lori Severson,
Yes.
Andy Todd,
Yes.
Richard Anderson,
Yes.
Kevin Adams,
Yes.
Dick Miller,
Yes.
John Austin,
Yes.
Don Waldera,
Yes.
Robert Becker,
Yes.
Renee Lyon,
Yes.
Kellen Nelson,
Yes.
David Larson,
Yes.
Jeannie Nutter,
Yes.
Ron Johnson,
Yes.
Bridget Turner,
Yes.
Stacy Klein.
Yes.
Passes 16-0.
Okay. Thank you. Next one is authorizing the transfer of unassigned general fund to Highway Department for winter maintenance construction.
Whereas the Trempealeau County Highway Department, thereafter Highway, maintains and constructs roadways throughout Trempealeau County for the safety and benefit of those who travel such roads each day. And whereas the Trempealeau County Board of Supervisor, hereafter Board, recognizes the importance of the Highway Department's winter road maintenance responsibilities, as well as its own budgetary responsibilities. And whereas in 2025, Highway will require for winter maintenance the amount of $400,000 in addition to those proposed budget amounts otherwise held by and entrusted to the Highway Department. And whereas there are sufficient funds in the undesignated general fund available to cover the amount of $400,000 for the 2025 highway winter maintenance purposes. Therefore, be it resolved that the Trempealeau County Board of Supervisors approves the transfer of funds from the unassigned general fund 101.32100 in the amount of $400,000 to the Highway Department account 101-533-12999 for 2025 highway winter maintenance purposes. Signed by Bridget Turner, David Larson, Richard Seisha, John Austin, Robert Becker, Exec Finance Committee.
Motion for approval? Motion by
Second.
Supervisor Becker, seconded by Supervisor Adams. Call the roll.
Any discussion? Any discussion?
Yeah, is there any discussion
Yeah,
at
so
all?
what's the deal on it? John,
It's-
did you, what's this all
Because
about?
we didn't put it in the regular budget for,
Oh,
we were gonna wait until after just to pass the budget.
If I can speak up, Mr. Chair,
Yes, go ahead.
this was part of a change from our budgeting process. It was my doing. It makes no difference from the unassigned general fund. The original budget wanted to take 400,000 from the general fund as part of the budgeting process. We took that away from the budgeting process and made what I call a business decision to put that much money in. It was in an attempt to maintain our credit ratings.
Essentially, we were going to spend the money one way or another. It was just
Correct.
the how.
Okay, any other questions? Nothing, just call the roll.
David Larson,
Yes.
excuse me, Jeannie Nutter,
Yes.
Ron Johnson,
Yes.
Bridget Turner,
Yes.
Stacy Klein,
Yes.
Richard Seisha.
Yes.
Lori Severson,
Yes.
Andy Todd,
Yes.
Richard Anderson,
Yes.
Kevin Adams,
Yes.
Dick Miller,
Yes.
John Austin,
Yes.
Don Waldera,
Yes.
Robert Becker,
Yes.
Renee Lyon,
Yes.
Kellen Nelson.
Yes.
Okay, passes 16-0.
Okay, next one's from Personal Bargaining Committee, the Police Association contract.
Whereas a tentative labor agreement has been reached between the Wisconsin Professional Police Association, WPPA, representing detectives and deputies in the Trempealeau County Sheriff's Office, and the Trempealeau County Personnel Bargaining Committee for the period of January 1, 2025 to December 31, 2026. And whereas the tentative agreement has been endorsed by the members of the Employee Bargaining Union and by the Personnel Bargaining Committee of Trempealeau County. And whereas the tentative agreement is attached, and whereas through this labor agreement, wages will increase by 5% each year over the 2-year period, resulting in a total cost increase of $191,000, 893.58 cents. Now be it resolved that the Trempealeau County Board of Supervisors hereby ratifies the labor agreement between Trempealeau County and WPPA, the original being on file in the County Human Resources Department. Signed, Renee Lyon, Jeannie Nutter, John Austin, Kellen Nelson, Ron Johnson, Personnel Bargaining Committee, and David Larson, John Austin, Robert Becker, Richard Seisha, Bridget Turner, Exec Finance Committee.
Second.
Motion by Supervisor Johnson, second by Supervisor Lyon. Any questions at all or comments?
I didn't see the tentative agreement attached. Did I miss it? But I guess I'm just curious. So apparently we've been part of this labor union for some time. This isn't new. It's just a renewal, correct?
It was a renegotiation. I mean, we started, it's been going on, you know, the law enforcement was left out of Act 10, so
Gotcha.
It's a new contract.
that was me, Jeannie Nutter, talking.
I
Thank
think we
you.
knew that.
Sorry.
Okay,
Mr. Chair,
yes.
since we didn't, I don't think we had a copy to view, were there any other issues in general? I'm not asking specifics necessarily, but any other issues that were part of that agreement and changes in that contract?
Basically, that's a 5% increase, and they, each year of the 2-year contract, and they received a little bit of an increase in their cost for uniform allowance. Other than that, they got the same holiday additions that the rest of the staff got throughout the government center, and so that was basically it.
Yeah, there wasn't really anything besides that.
5% is the primary, okay.
They didn't really ask for much.
They asked for enough. We came to a good agreement, I think, so.
We did. It was it was longer than we have done
There was
previously,
negotiation
but-
involved.
Yeah.
And I will say, we worked with Weld Riley, and we did have a lot of really good comparison information on what wages are going up, and this is a good wage increase for them, so it was.
I agree. I wasn't in all negotiations. I was on in a couple of them. And also being, me, myself, is in a couple of my other current and or previous jobs, I have some management experience, some in financing, but I agree is my former supervisory experience and current one, I think this is a good balance of still keeping within budget yet appreciating our employees, because even the one employer I work for, which I'm in a supervisory role too, because of inflation that came to times too, we had to raise our starting pay by an hour. So everybody's had to raise it, not just us, so.
Okay, no further questions, we'll just go with the roll.
John Austin.
Yes.
Dawn Waldera.
Yes.
Robert Becker.
Yes.
Renee Lyon.
Yes.
Kellen Nelson.
Yes.
David Larson.
Yes.
Jeannie Nutter.
Yes.
Ron Johnson.
Yes.
Bridget Turner.
Yes.
Stacy Klein.
Yes.
Richard Seisha.
Yes.
Lori Severson.
Yes.
Andy Todd.
Yes.
Richard Anderson.
I will abstain.
Kevin Adams.
Yes.
Dick Miller.
Yes.
Okay, passed. Audit Committee, members' claims?
Whereas the Audit Committee has audited the following claims and recommend that they be allowed as follows. John Austin, $918.59. Kevin Adams, $190.20. Richard Anderson, $297.25. Robert Becker, $292.88. Ron Johnson, 0. Stacy Klein, $374.62. David Larson, $183.50. Renee Lyon, $200. Dick Miller, $182.16. Kellen Nelson, 0. Jeannie Nutter, $443.80. Richard Seisha, $389.36. Laurie Severson, 0. Andy Todd, 0. Bridget Turner, $607.28. Dawn Waldera, $209.38. Kevin Whalen, $126.80, for a total of per diem $3,500, expenses $915.82, for a grand total of $4,415.82. Now be it resolved that the claims be allowed as shown. Signed by John Austin, Stacy Klein, Richard Seisha, Audit Committee.
Motion by Johnson, seconded by Seisha. Okay, any questions at all? We're gonna call the roll.
Lori Severson,
Yes.
Andy Todd,
Yes.
Richard Anderson,
Yes.
Kevin Adams,
Yes.
Dick Miller,
Yes.
John Austin,
Yes.
Dawn Waldera,
Yes.
Robert Becker,
Yes.
Renee Lyon,
Yes.
Kellen Nelson,
Yes.
David Larson,
Yes.
Jeannie Nutter,
Yes.
Ron Johnson,
Yes.
Bridget Turner,
Yes.
Stacy Klein,
Yes.
Richard Seisha,
Yes.
16-0.
Okay. You got it.
What's that?
Where is it?
He abstained.
No, I'll do it to her own. Where's it?
This was for the union contract.
Okay. Item 7, there is no announcements as far as I know. No announcements and no appointments, so we'll bypass that one. Go to item 8. Exec Finance Committee budget under county sales tax. Get the sales tax report.
I'm not on site to see what was passed out, but the quick of the budget update, it looked all right. The county sales tax is holding on to the budget and a little bit extra. And the general fund hasn't changed since last month.
Okay. Economic Development and Tourism Manager Dave Carlson, consider a letter of endorsement to the 2 internal service providers.
Thank you and good evening. I'll try and keep this brief. Just as way of background, I think we've been talking about BEAD, B-E-A-D, for a couple of years now, and the promise has been that there would be money coming down from the feds through the state under this BEAD program, which stands for Broadband Equity Access and Deployment. And we got a grant about 2 years ago for around $18,000 to do some work to help try and identify what the unserved and underserved areas of the county were. As you can imagine, 18,000 doesn't get you a lot as an individual county, but we partnered with Buffalo, Pierce, and Pepin counties, formed the Quad County Broadband Consortium, and hired a consultant who did a lot of great work in terms of verifying some of the existing reports on service areas, and then also did a really great service for each of us too in identifying potential internet service providers that could serve, would be a good match for those areas, did some outreach on our behalf. So that's just a little bit of background in about 60 seconds to get from getting that BEAD grant to where we are today. So what the state has done now, the Public Service Commission, has opened up applications for internet service providers or ISPs to serve particular areas, for particular project units, as the Public Service Commission has identified them. And there's 2 internet service providers that actually reached out to the county and went through the process that we established, which was if you're seeking our endorsement, which is part of the application process, it gets you a certain number of points if you have a county endorsement of your plan or application to serve. And so we had 2 that came to our PTED meeting earlier this month, did a presentation, when we're seeking endorsements, and those were Cochrane Telephone Cooperative, which has plans to serve in the town of Dodge, town of Trempealeau, and town of Arcadia. And then Brightspeed, which is looking at serving in a variety of different areas, but basically concentrated sort of in the, I would call it southeast portion of the county, so like Ettrick, Gale, those areas. So what's in your packet is a memo that I prepared, as well as a couple of letters, one for each Brightspeed and Cochrane Telephone Cooperative, as well as the actual proposals that they shared with the PTED committee. So what the Public Service Commission requires for these companies that are seeking those 5 points, I think it is, for endorsement from a county, is to show that there was a meeting during which there was an opportunity for the public to be heard at the meeting and be part of that meeting. So that was PTED on January 7th, I believe it was. So minutes of that meeting with the committee action, and then it would be the county board minutes from tonight if you go along with approving these endorsement letters. I did include the endorsement letters. I know with resolutions you like to read those. And if you would like, I would be happy to read aloud the endorsement letter. Otherwise, what I would be looking for would be approval of the 2 endorsement letters that were included in your packet, which would then be signed by the county administrator. We would not be able to, we'd be able to submit those right away, the supporting documents, including minutes of your approved minutes. We won't be able to do it till your February 17th meeting.
And that's when the resolution will come through?
If you would like a resolution drafted that encompasses all of this, we could do that. The PSC either will take a resolution or a letter of support. So if you're comfortable with the letters that were in your packet, you could just simply move to approve those letters, and then Becky would sign them and we'd send them out.
Fine with me. Is there any other objection to that? No objection? Somebody want to make a motion to approve?
I'll move to approve. I'll second it.
That was Bridget.
Lori Severson.
Oh, Lori Severson seconded it?
Yeah.
Okay. All those in favor signify by saying aye.
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 Aye. Aye.
Okay.
Thank you very much.
Carried.
Thanks, Dave.
Item C, Parks, Tourism, and Economic Development, to remove Jeannie Nutter and add Richard Anderson to the PTED committee. Is there any objection to that, or somebody want to make a motion to that effect?
You just need to fix that sentence. It looks like You were removing me and Richard.
Yeah.
So it should say
it's
remove
remove and
Jeannie,
add.
add Richard.
We did. That's been done.
Oh, okay, I'm sorry.
That's
Okay.
been done. Remove Jeannie and add Richard.
I
So-
move that we remove Jeannie Nutter from the PTED committee and add Supervisor Richard Anderson.
I'll second it.
Too late.
Oh, good, that's fine.
Motion by Supervisor Lyons, seconded by Supervisor Johnson. All those in favor signify by saying aye.
Aye.
I-
Opposed? That's carried. Board of Health. Remove Stacy Klein and Lori Severson?
Yes.
It's right this time? Okay. Okay. To remove them from the committee because they, with the merging of the Board of Health and Human Services, we were abundant numbers of supervisors. on the
Mr. Chair, may I speak?
Yes.
I just want to thank, as Chair of the Board of Health, I want to thank both Lori and Stacy, both very valuable members to that board. We'll definitely miss you in this merge, and certainly there's always an opening. You might get a call. Thanks, guys. I appreciate it.
Okay. Did we get a motion there? I don't think I did I? Motion to remove Stacy and Lori from that committee.
I move that Stacy Klein and Lori Severson be removed from the Board of Health committee.
Okay.
I'll make that motion.
I'll second it. See, I don't think we can hear them when they're making motions.
But you
I
just,
know, I can't hear him either.
oh, you did, yeah, take care.
John is talking so softly.
Who,
Bridget made the,
Bridget and Lori.
okay, Bridget, well, we'll take the motion from Supervisor Turner and the second from Supervisor Severson. All those in favor signify by saying aye.
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 Health and Human Services Board. Bridget Turner, Dick Miller, and Kevin Adams. Don Walder and Jeannie Nutter. Yeah. And advisors to the board are Richard Anderson and Ron Johnson. Citizen recommendation from the county administrator. Did you make one?
I have that, and so if you're ready, I'd like to read a letter that's coming from Jay, and then I'll, yes, it is my recommendation to do, this is from Jay Hine, Health and Human Services Director. I'm requesting that Dr. Kimberly Breidenbach and Dr. William Baxa from the Board of Health, as well as Karen Sippick and Scott Brown from the Human Services Board, be appointed to continue their citizen member terms on the new combined Health and Human Services Board in order to ensure we are meeting statutory requirements under Wisconsin Chapter 46.23, paren 4, paren A1, and Chapter 251.03, paren 1. This also provides appropriate representation for both of the previously separate boards and departments. Dr. Breidenbach fulfills the medical professional perspective and requirement for a local health department. Dr. Baxa is a local dentist who provides valuable perspectives on community health issues. Karen Sippick has many years of service to people with disabilities, has held high-level leadership positions, and offers the long-term care perspective for county human services programs. Scott Brown also has many years of service to people with disabilities and mental health issues as a case manager and advocate, as well as being a participant in various human services programs. Thank you for considering their appointments to the new combined board. I'd like to bring those forward to the board for approval.
Okay, what I'm looking for is a motion to approve them all at once. Is there any objection to that?
Move to approve.
Motion by Supervisor Nelson. Second by Supervisor Adams. Any comments? Hearing none, all those in favor signify by saying aye.
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 Sounds like it carried.
And then just a reminder, our first meeting for that combined board meeting is February 10th at 5:30.
Okay. Correspondence, I didn't have any, did you? No?
Shared mine already.
Anything? Okay. Instruct the clerk to pay homage. Any motion to do that? Motion by Supervisor Johnson and seconded by. Seconded by Supervisor Becker. Item 11. Oh, vote. All those, gotta
Roll
call.
call.
Call the roll call.
Bridget Turner? I'm sorry. Bridget Turner?
Yes.
Stacy Klein?
Yes.
Richard Seisha?
Yes.
Lori Severson?
Yes.
Andy Todd?
Yes.
Richard Anderson?
Yes.
Kevin Adams?
Yes.
Dick Miller?
Yes.
John Austin?
Yes.
Don Waldera?
Yes.
Robert Becker?
Yes, please.
Renee Lyon?
Yes.
Kellen Nelson?
Yes.
David Larson?
Yes.
Jeannie Nutter?
Yes.
Ron Johnson?
Yes.
16-0.
Okay. Looking for a motion to go into closed session. Somebody want to read it? You want to read it?
Item 11, closed session item, discussion and action with counsel regarding legal developments from recent petition. This item is in closed session pursuant of Wisconsin Statute 19.85, parenthesis 1, parenthesis G, conferring with legal counsel for the governmental body who is rendering oral or written advice concerning strategy to be adopted by the body with respect to litigation in which it is or is likely to become involved. If necessary, the board may authorize the action in closed session to avoid compromising the need for this closed session.
Make a motion to go to closed session.
Motion by Waldera,
I'll second.
second by Supervisor Lyon. Okay, call the roll. Got to call the roll to go into closed session.
Renee Lyon,
Yes.
Kellen Nelson,
Yes.
David Larson,
Yes.
Jeannie Nutter,
Yes.
Ron Johnson,
Yes.
Bridget Turner,
Yes.
Stacy Klein,
Yes.
Richard Seisha,
Yes.
Lori Severson,
Yes.
Andy Todd,
Yes.
Richard Anderson,
Yes.
Kevin Adams,
Yes.
Dick Miller,
Yes.
John Austin,
Yes.
Don Waldera,
Yes.
Robert Becker.
Yes.
Okay, we're in closed session.